Hello, my name is Jim, and I'm a lab technician at the Center for TMJ and Sleep Apnea, Dr. Larry Pribble's office. And in this video, I'd like to talk to you about an oral sleep appliance called the TAP. But before we get into that, I'd like to discuss reasons why you make adjustments to sleep appliances. Reasons why anybody would make an adjustment is if someone is still snoring at night, or if they're having apnea events at night, if they wake up feeling drowsy, or if they have daytime sleepiness. And you never want to make an adjustment to an appliance unless a doctor tells you to. And when you do make an adjustment, they need to be in real small increments because the way treating a sleep apnea with an oral appliance works is that it takes the lower jaw and moves it forward, which opens your airway and allows more air to reach the lungs and hopefully decreases your apnea symptoms. So when you make an adjustment, if you do it too far too fast, you can push that jaw too forward and cause harm to your jaw joint and have pain and other symptoms there. So you want to be real careful before you make adjustments. But we'll get into this particular appliance here. This, once again, is called the TAP. That is the Thornton Adjustable Positioner. And it's an FDA approved sleep appliance. It's 2 pieces of hard acrylic, custom fit to fit only one person. And the unique thing about this appliance is it is one of 2 appliances that is approved by Medicare. So just a fact for you there. The way you make an adjustment, if someone's still having apnea events and we want to make an adjustment to the appliance, how you do that is through this screw mechanism here on the upper appliance. And how that would work is this moves along the track here as you make turns to it, and it pushes the lower appliance farther forward, moving your jaw farther forward, hopefully opening your airway and decreasing your apnea. So how you would make an adjustment to this is the appliance fits in between these 2 bars here, and you just put it in there and twist, and then it is hooked on there. And as you'll see in the front of the appliance, there is a little hole in the front. That's where the adjusting key goes. And so you just place this in the front here like so, and you make a turn. Now, one full turn, 180 degrees, is 1/4 of a millimeter. So 4 180 degree turns will move the mandible a total of 1 millimeter. So there's not a lot of distance that needs to be made to make a difference in someone's apnea. And the great thing about this appliance is it is the only sleep appliance that you can adjust while it is still in the patient's mouth. You do not have to remove this appliance to make adjustments to it. So if a patient brings this to a sleep lab to get a sleep study done, they're going to take with them a piece of paper called a sleep protocol, and that will explain to the sleep technician exactly what adjustments need to be made throughout the course of that person's study to try to find their optimal position to treat their apnea. So the benefit of this particular appliance is if they're in their sleep study, they don't necessarily need to be woken up to have the adjustments made. The sleep technician could just come in with this still in their mouth and make the necessary turns to their appliance while they're still asleep. So once again, that's how you adjust this appliance. It is called the TAP, and thank you for watching this video.